Let's welcome Dr. Fitzgerald for his weekly COVID-19 update. With his extensive background as medical technologist, today's topic is antibody testing.
Hey, you guys, Doc Fitz here. What Kathleen just said, I'm really proud of, actually. I am a medical technologist that became a physician. I ran a DNA lab back in 1985, ASCP certified medical technologist, could run the hospital laboratory back in the day. So this testing stuff is right up my alley, and we're so glad you're here to hopefully learn the difference between some of the swabs versus the blood test. It's really, really important because I gave a short little lecture last week, and we had some Danielle person who really lit up our Facebook with horrible, horrible things, saying it's a scam and this and that, and it was really kind of hurtful. Any healthcare professional in any field that has any brains at all really knows the Stark laws. I mean, physicians, we can't make any money off the blood test or the nasal swab as part of the Stark laws. So we don't make money off of lab tests or MRIs or tests that we order. So it's really, really important that we really just want you to know the information to help you and your family about the nasopharyngeal swab versus the buccal swab versus the serology, the blood test. The breakthrough really is and has been the blood test. This is from Quest Diagnostics, and this is right from Quest. Quest processes all of our nasopharyngeal swabs, our buccal swabs, and our blood test. Now, a cute little example. This was really, really fun. To explain, our daughter Colby is a junior at Florida State University. She had a horrible, horrible, horrible sore throat. It was really, really bad. And a lot of times people want to do like a throat culture. So they take a little swab and they got to go, you got to follow how far. That far back to get to my tonsils. Well, Colby's a little, tough. They try to do that to her, she gags, and it only gets to the roof of her mouth. So then they say, hey, Coco, you have a negative strep test, which is called a false negative. That is a false negative, meaning she actually has wicked strep. They just didn't get operator error, the Q-tip, to the right place. So, crucially important. We called her, she wasn't getting better. Dad, my throat, it's getting worse, it's getting worse. She came home, and me being a medical technology lab rat and a physician, we drew her blood. And we did an ASO titer and a monospot. Anti-streptolysin O blood draw and a monospot blood draw. Colby ended up having both issues, which is why she was so terribly ill. But it's so important when you're looking at the nasopharyngeal swab. They take the swab and they got to go all the way back here up high near the back of the sinus. The buccal swab they can just do in the mouth and send out. The blood draw is absolutely amazing. Next slide, because this can tell you if you've been exposed to the virus and if your body has reacted and produced antibodies or proteins against that virus. This is really fun, Jack. If you can get closer, we get a picture of it later. This is the initial response of IgM antibodies that after you're exposed by the virus, your body produces in the serum to fight off the virus or whatever you've been exposed to. The IgG is the old gold, we call it. It's the memory. It's the memory of having been infected even from November, December, or January. So to make a long story short, the IgM is the acute phase reactant when you're fighting off an acute infection, and it's showing that you've been recently exposed and your body is actively fighting off that virus. The IgM then starts to come down, and exponentially up comes the IgG. We call that the IgG, the old gold. The IgG confers that you may possibly be immune from ever getting this again. But is it possible to get reinfected? Yes, it is possible to get reinfected. But because you have that IgG, that old gold, any subsequent infection, the secondary response would be 10 times greater for that IgG. So your symptoms could be way, way, way fewer. So that's the thing with the IgG and the IgM. The neat thing with the IgG, if you saw recently on a lot of the TV channels, they're planning on doing all of this serology for as many people as they can to see if there's what's called herd, like a herd of cattle or herd immunity. If they can see how many people in a certain area have this IgG that didn't get terribly ill or generate a visit to me or to the hospital, then they got really great statistics. How safely can we open up our economy and the rest of our businesses? So the beautiful thing just for you, for the individual person, Selma, myself, all the first responders, we did our swabs and they came back negative, which was great. Then we did our blood. Yes, we did the serum, Danielle, in South Tampa. And Quest processed all of our samples. And even though we're seeing 40 people a day, sometimes 50 people a day, we have not had the infection according to the IgG serology. So we got to be incredibly careful because we are not immune yet to that virus. So the vaccine, when it comes out, maybe we take the vaccine down the road because we're not still immune. However, for a lot of the people that had the virus and they got better, they have the cure coursing through their veins. They have the IgG, the old gold. That is the gold, the convalescent plasma that can help so many people that are still ill, where they can literally donate their blood, take out that monoclonal antibody, and donate it to people that are really ill. So incredibly exciting stuff. I hope I made that a little nicer to understand, the swabs versus the serum. The IgG, so the really amazing part of the serum, the blood draw, when we draw your blood versus putting stuff in your nasopharyngeal cavity or your buccal mucosa, the blood draw has the IgG and IgM, and those are the serum antibody, the antibody test everybody's starting to talk about. I love the antibody test because it's coming from your serum. It shows that you mounted an immune response if you were exposed to the virus. The IgM, again, is the acute phase reactant, which shows that you're kind of actively just starting 7 to 10 days with the infection. The IgG starts coming up like 10 days later and stays. The IgG is the memory. The IgG serum antibody test, that antibody IgG confers you may be immune. And can you possibly get infected again? Possibly. But if you do get infected a little bit again, you have that memory. IgG is the memory. Wouldn't it be nice if IgM was memory? But it's not. IgM is acute. IgG, I keep teaching my residents, is the old gold. The IgG is the memory. The IgG is the immunity, where you could literally show people at work. You could show people, hey, listen, I don't need the immunization. I don't even need the shot because I'm already immune because I have the IgG. Or if we got the shot again in the fall, that would give us the secondary response and give us more IgG, so you'd even be safer from the virus this fall. So lots of different ways to look at it. This is absolutely phenomenal. But this individually, this serum antibody test really lets you know that you're safe, and you're safe for other people, around other people, that you're immune. Or do I still have to be incredibly careful and wear the mask? We all should wear, be careful and not spread and wash our hands. But the big difference is if you have that old gold, that IgG, man, that'd be great because that means you're immune or potentially immune from this virus. So I guess there were more questions that were going to be asked on our Facebook. I'd like to try to answer those as well.
Here are some great questions that we received from our social media platforms. Okay. Question number 1, does insurance cover it?
That's a great question. Each insurance is different. Again, it's really important. Doctor makes no money from blood or specimens. We get no money for testing. We're just the middleman, the ones that say, hey, we kind of meet criteria, we've had an exposure, I would really like that test. And we order the test, and some insurances cover all of it, and some of them it's really up to the individual plan.
Awesome. Okay. What if you don't have insurance? What does it cost?
If you don't have insurance, our visit here to see me is really inexpensive. It's $125 just to walk in. The laboratory is around $200, I guess, to pay cash, right around there. You can't quote me on that. That's just what I've been told as far as the cash price for the serum antibody test. But we're still working on the lab for the cash price.
Okay. When do you start taking appointments?
We take appointments. We're here Monday through Saturday, so Monday through Saturday, we'd love to see anybody who wants to test.
Okay. Is it covered all or part by Medicare or Medicaid?
That's a great question, because everybody's got like Medicare with a supplement or a Medicare with an Advantage plan or whatever. Again, it's based on that individual plan's benefit package.
Okay. Do you also test kids and toddlers?
All day long.
Great. Is it free?
I don't know about free. Again, it depends on the individual plans and what they cover.
Do you get the results right away? If not, how long does it take to get back?
That's a great question. Our nasopharyngeal swab is when we're going there with like 5 to 7 days. This the serum blood draw antibody test is 3 or 4 days, and we're getting those pretty rapidly from Quest, 3 to 4 days.
Perfect. Will antibody tests have super public results like regular testing?
I kind of don't know what that question is asking. I think it's, if you saw the TV, I mean, like New York and Mayor Como, and they really want to do antibody testing for as many people as they can. I had a graph from one of our earlier lectures. 81% of people had the virus, got better, convalesced, and went on with their day, a little Tylenol. It would be nice to know how many people had the virus, were asymptomatic, and kept going, that they can go on with their daily life. The antibody test from Quest and the serum test really makes you feel good. Look, I got IgG, I'm most likely immune, and even if I get a secondary little infection in the fall, I've already got the antibodies, almost like an immunization, to fight this off again in the fall. So I'm kind of not understanding what that question's asking.
Okay. What test are you using?
We're using the Quest serum test, which is obviously Quest, one of the most respected labs in the country. We've worked with them for 27 years now. Phenomenal, ethical turnaround time. And again, doctor gets no money for tests. We make no money off of a blood test or a nasal swab or a serum antibody test. We just need the information. With the Stark laws, we get no money for blood or labs.
Okay. Is it true you need to have had the virus within the last 2 weeks to give plasma?
So, no. So in order to give plasma, the convalescent plasma to help other people, you got to be symptom free for 14 days, and they will probably do IgG, IgM antibody serology testing to make sure there's no active infection, because the IgM, you could pass active infection. The IgG is the old gold. That's the convalescent plasma that can help everybody that's acutely ill. So usually no symptoms within 14 days, and then they will decide whether they can take your plasma to help other people.
Great. Okay. Do you have to schedule an appointment, or do you take walk-ins?
Oh, we take walk-ins. We're so blessed this time of year, though. Appointment's always the best idea.
Okay. How many people are located in the office at a time?
In the office, we still try to do social distancing. We've been following that very closely and carefully. It's a relatively large building. So it's just really important we do keep everybody, far apart, wash our hands, and clean every room in between patients. Another really good point about the testing was Quest with the serology, the serum antibody test is in phase 1 and phase 2 trials in the hospitals. They're using that for their people on the front lines like us. I mean, we're on the front lines, so you want to know if you're immune or not, or do you need to, we all need to be careful, but if you've got the IgG old gold, we can kind of be safe. We know that we're okay and we're not going to spread it to other people most likely. That IgG, the old gold, is fantastic to know. Now, Selma and I recently did ours, and a lot of folks here as well, and we never missed a day. We've been working through this entire nightmare, and even seeing all of those patients the last 2 months, I still tested negative for the IgG, which means I haven't had the virus yet, which is a good thing because I have asthma.
Right.
But at least I know that I've got to be extra careful, wash my hands, distance, and be safe. Where if you've got the IgG, of course you can be safe and everything, but it's so nice to know that you had it convalesced and you're like basically immune from it. So I kind of wish I had the IgG.
All right, where are you located?
12464 Indian Rocks Road,
Awesome.
Largo.
All right, just a few more. If If I had a virus a few months ago, will the test show if it was coronavirus and if I have antibodies?
That's a really good question. On the graph that we showed you there, the IgM goes up and it comes down, and you don't really see the IgM after 10 to 14 days. The IgG goes up exponentially, and normally that will confer that you've had the virus and you're immune for a long, long time. If you get secondarily challenged again by the same virus, it'll go up even exponentially, then you'll see it for sure. So you got to remember, Quest is an amazing lab and they're amazing people. I'm a medical technologist. All of these tests are run by human beings. There's lab error, there's possible mistakes. Never treat the test, treat the patient. Never ever treat the test, treat the patient. So the test is what you're supposed to use to confirm what you might be thinking. If you don't agree with it, check it again, do it again, and do it again. The most important thing is never treat the test, treat the patient.
Awesome. All right, and last question. What insurance does your practice take?
That's got to be a phone call up front. I'm really lucky. We take a lot of different plans, but they change every year, and I can't keep straight. A phone call to Mo or 727-596-5446. Hey, what plans? And if we don't take the plan, is a good question. People can still see us. We're really inexpensive. $125 for a new patient visit. I can write a prescription for the serology, the antibody test. They just got to take that prescription to whatever lab is on their plan. So we can still see a lot of people, even if they just want to see us.
Awesome.
Well, we hope that clarifies a bunch of questions or questions you might have. We sure appreciate all you kindness warriors and the wonderful comments from hands across the bay after we got attacked by some really sad people. We just hope that everybody stays safe. We all keep going. We're here to serve. Again, doctor gets no money for lab tests or blood draws or nasopharyngeal swabs. We don't benefit financially from that. This is not a scam. This is only because we love you guys and are on the front lines trying to help. So keep up the good fight. You guys are doing it. Hopefully everybody's getting back to work. And we got to be like too blessed to be stressed. Just all keep going. Thank you very much.